we're going to go ahead and get started. It already feels great with the level of interest in this new program for the county, which I have to share with you that I made sure that the Sheriff's Office employees, the constitutional offices, would also be included in the discussion. Director Gulhar and I had some discussions probably, 2 years ago?
Yes.
And thought this would be something that needed to be looked at. He took it and ran with it. He said he has experience in implementing these kind of programs in 2 other areas. So this isn't his first rodeo with this sort of situation. But the bottom line way that this is going to be successful in lowering our medical costs is if we use it in the way that it is designed, and to make sure that we are informed, which I appreciate everyone being here, informed about how it can individually and therefore then collectively reduce our medical costs, okay? So I'm going to turn it over next to Sean to introduce staff, and hope you've got notebooks to take notes.
Thank you, Sheriff. Just real quick, we're gonna you're gonna be able to meet the staff of the new clinic. What we've handed out to you, there's an invitation, there's an open house tomorrow night from 5 to 7. You can go visit the clinic, meet the doctors again, see the see what your money's paying for. It's really a really nice facility. The magnetic card, keep at your desk, keep in your cars, has the phone number and the website, and they're going to explain to you, but you can make appointments, call, same-day appointments, all that kind of stuff. But I'll let them get into the nuts and bolts of that. Treasure Coast, Dr. Edelberg.
I'm Dr. Mike Adelberg. I'm the president of a little company called Treasure Coast Medical Associates. The mission of our company is to save municipalities and large employers and their employees and the taxpayers money on their health insurance and the cost of providing that benefit to employees. One of the ways that we do that is providing a facility that expedites your health care. The facility is designed to be a broad catch. It has an x-ray room. It has a pharmacy. It has a pleasant, cheerful, competent physician who everybody, I guarantee, is going to like. He actually really is. I know Dr. Bernstein from years of practicing in combat zones called emergency rooms. I started out life as an emergency room doctor. I have my American boards in emergency medicine, and I have no idea how I got into this, but here I am. Sometimes I think I'm more comfortable with a gunshot wound than I am with I don't feel well. But Dr. Bernstein is a lot better at it than I am. We'll have nurse practitioners. Most of the staff is local, and they know the area, and some of the staff has even worked for the county, either in the sheriff's office or in other arms of the county service that it provides to its taxpayers. So it's a staff that I think you're going to find is going to be accommodating. I'm going to talk to you just a little bit about some of the detail. The clinic is designed to take appointments. You can make an appointment. You can actually do it online. You can make a phone call. You can send us an email. You can do whatever, however you want to do it. As long as we get the message that you want to be seen and roughly what time you can be seen, and unless there's some other employees, we'll call them patients, that, other than with constraints inside the typical doctor's office schedule. The schedule is designed so that you can use it as a walk-in clinic. If it's 3 o'clock on a Friday afternoon and you need something, you just show up. I mean, obviously, we think it's best if you can make an appointment whenever you can, because it'll minimize bottlenecks at the front desk and so on and so forth. But I mean, if you can't, we don't want to turn anybody away. If you walk in and it's not busy, you're going to be seen like it'll take your breath away how fast you get seen. But obviously, if it's waiting, well, it will. It might take your breath. I'm going to say it might take your breath away at how short it is or how long it takes. But either way, your breath's going to be taken away. But what you do get is you don't pay a copay. The way that we have the relationship with the county and the way that these things work is designed to remove the copay as a barrier to your health care. There's a generic pharmacy, and last I heard there was right around, was there 100 and, what, 200 and?
It's like 200 on the list.
There's 200, we built the pharmaceutical list based on what most people take for the usual reasons. And there's gonna be some outliers, and there is a way to deal with that. But it's gonna take your copay away from when you go to the pharmacy. It's gonna take your copay away from when you go to the lab, because we do lab services on site. It's all part of the program. So basically, for all intents and purposes, your copay goes away. The other thing that goes away, of course, is the amount of time it takes you to see a physician, to get an order for labs, and possibly, I don't know, maybe somebody in here is on thyroid medication, whatever it is. It all can happen simultaneously. You get your labs drawn right there on site. We do some of the labs in-house, some of the stuff we send out, but you don't have to go anywhere. All you do is you show up, hold your arm out, squeeze whoever's hand, and try not to scream. And then, of course, the pharmacy is there with about 200 of the most common medications. But I also want to talk a little bit about how we dreamed the pharmacy up. Because everybody's thinking, I wonder if they have my drug. I wonder if my drug's generic. I wonder if there's something else. What do I do? Well, here's the answer. The pharmaceutical formulary, as we call it, which is the list of medicines on there, is not a static phenomenon. We built this pharmacy, the formulary, based on what we think is going to happen here, based on experiences that we've had with other sheriff's offices, with other municipalities. So we think it's pretty close, but each population is different. And so whatever it is now, it's probably going to change. And the two forces that cause the formulary, all the drugs that you get, to change, the two forces are the needs of the employees, right, you guys, and the styling practices of the physician. If you talk to 5 doctors, they'll tell you 5 different things. They all might get the job done, but there's more than one way to skin a cat in medicine. That's why we call it an art, not a science. So the formulary can change. So if you have for instance, if you're one of the folks that falls into that 8 or 9% of the people that are not going to have the medicines that they need in that formulary, and can't be adapted to something else, in other words, go to plan B to get the same job done, we have a relationship with the county that allows us to order medications specifically under certain circumstances. And if we know you need a 90-day supply of X and we don't have X, well, we can order X. I mean, here, the upside to this is same deal again. You don't go to the pharmacy. You don't pay a copay. It means you don't have to drive across town. I've discovered what Gainesville traffic's all about. That was an interesting experience, especially around 7 o'clock last night. And so maybe we won't have it at that point, but 4 or 5 days later, I think it's 5 business days, we can have just about any medication. It'll be there, and you come back around and get it. So like I said, the message to take away here is that whatever it is that's on our formulary, if you're one of those 8 or 9% of the people, that formulary is adaptable and modifiable so that we hope we can accommodate everybody. The hours of operation, the other thing that you're going to love. It's open 56 hours a week. Some days it starts very early in the morning to accommodate for folks who are coming off shift or going on shift. Some days it's open a little bit later, but in general it's a 10-hour-a-day operation, except for Saturday, which is 6 hours a day. And generally, I don't think we take appointments on, correct me if I'm wrong, we don't take appointments on Saturdays. We brought that for the walk-in. If your kids are sick or you twist your ankle falling off a whatever, whatever it is you fall off of around here. Come on in and as a walk-in, just as you would any urgent care, same thing, again, no copay. We'll do the x-ray right there. We can read the x-ray, and those x-rays that we're not too sure about, and we're all kind of high-time ER people in key positions in my group just because of my ER background. if we can't read them in a matter of moments, we can send these images electronically to one of the radiology groups, and they can read it for us. And it happens pretty quick. And in our place, you got a brand new, beautiful digital X-ray machine, and like I said, those X-ray images come out in seconds. It's a computer. It's really what it is. So that's what happens on Saturday. So you got expanded hours, you got early hours, you got late hours, you got Saturday hours, and it could even go to Sunday hours. Same deal again. The hours of operation is also fluid. It's not dynamic. If we determine collectively that, hey, we need to be open at 6 a.m. this particular morning for fasting lab draws. One of the things that you may or may have had some experience in, I'll just jump kind of into this health risk assessment concept. Does everybody know what that is? Or that's where we kind of trying to find out what's keeping you from being healthy and try to talk you into doing the things that'll make you healthy. Sometimes it's well received. Sometimes it's like talking to a pallet full of drywall. Depends who you are. But we're going to do our best to get everybody through the HRA process and do some constructive feedback. I mean, what are the common things? Well, quit smoking, get some exercise, lose some weight, pay your taxes. It's things you probably already know, but hopefully we can put it in a format that's palatable, that you can actually will make some plans based on the HRA that will be effective and not painful. I don't know if anybody in this room ever felt they ever had to lose weight, but I think that's one of the hardest things in the world to do. I've never smoked before, but I know that it's tough to quit smoking because who wouldn't if it was easy? But that's the HRA. And so like I said, going back to the schedule, if there's times that it'd be more convenient after we get them to know each other, the schedule's dynamic. We just change the hours to accommodate. I mean, it's by decree, and if the employees of the county want to do their health care at this particular time, I don't see any reason that why we wouldn't want to change that schedule to accommodate. So that is my overview of what you got. I will tell you that the upside to the county administration for this, I mean, the upside for you is convenience and fast, friendly service, all that kind of stuff. But the upside to the county is that overall, it's been well documented in many, many other communities in the nation that bypassing your third-party payer, Blue Cross, Cigna, Aetna, whatever, that this is a by far and away more economical way of delivering health care if you have a population that's A, amenable, and B, big enough. And certainly Alachua County is both. So, and ultimately this saves money on your health insurance premium. It saves the taxpayers a couple of bucks. It's a good deal for everybody. And like I said, it's taking the country by storm. You're not the only employer, you're not the only population of employees that are doing this. This is becoming a very, very popular way for local and regional municipalities to deliver their health care benefit to their employees. Anybody have any questions for me that I can answer, that I know the answer to?
Dr. Adams, can you speak about the privacy and confidentiality of
Oh, yeah. I saw your hand back there. We have a relationship, a contractual relationship with the county. This is actually very important. But we don't tell secrets. Like, this is your healthcare data, the confidential conversations that you have with any of our employers or me occasionally, that is as secure as you going to your own doctor. It's all HIPAA protected. We don't want to tell your employers anything. They're not going to ask us anything. The only relationship that we have with the county administration is financial. So if some of you are concerned that Big Brother is watching your health care and we're going to tell them you got cooties if you got cooties, it's not going to happen. Can't happen legally, can't happen morally, it's bad for business, it's just not going to happen. Any other thoughts or comments about that? Sir?
How well will this program network with our family physician? I I have a relationship with my family physician that my wife and my 2 kids have been going to for 20 years, 15, 20 years. So if we still maintain that relationship and go with our family physician and they order things like blood work, how well will that interface? Will we be able to attend this clinic, get the blood work and the lab work done rather than going to LabCorp, pay the copay?
The short answer is yes. Dr. Bernstein.
Yeah. I'm Dr. Stephen Bernstein. So I'm going to tag back into that. So let me tangent around a couple other things. So I'm a family physician, aerospace medicine, retired Army, coming out of Fort Rucker. A lot of my police, the military up in, a lot of the police up in my area, ex-military. If you've been in the military, this is very a military style clinic, a DOD type clinic, whether Army, Navy, Air Force, Coast Guard. And so we're used to that. When you go in, you get seen, you do things, you mouse around, but hopefully without the inefficiencies of government, DOD, as we've been in sick, as anyone who's been in sick call knows. And you're chuckling already. So I'm a family doc. Lyra is a family nurse practitioner. Elaine, AKA Scotty, because you'll meet her and she's Scottish and she has a Scottish accent. You'll go, oh, that's why they call her Scotty. She likes Chihuahuas, not Scotties. That's the weird part. But she couldn't be here this morning. She's the other nurse practitioner. Oh, she is here. She's hiding in the corner. There is Scotty. So we're the team. We're the primary team. Dr. Adelberg will be up. And again, if we get more, if we volume business-wise, we need more docs. We have more providers. We'll bring more on. So I'm a family doc. Again, I've been deployed, Honduras, Iraq. I'm used to continuity of care. I love continuity of care. And so whether I'm being the primary starting pitcher, I'm a baseball fan, by the way, whether I'm the primary or I'm working with your family doc, again, I have no problem with that relationship to be able to work with him as long as he talks back. Because if he orders a bunch of labs, yeah, we can draw him. The question, sometimes I'll call him and go, why are you getting this serum porcelain level? Help me feed this out. Because when we draw labs and we fill stuff, I'm the one responsible, or Lyra or Scotty. We take ownership of that. So it's got to make sense. It's got to pass the common sense test. Otherwise, Mr. Goodhart is going to come down and choke me. Probably. But it's having that relationship. And so the thing I encourage is, be able, so we can have the record so that way we can dialogue back and forth. Or, again, the typical thing is it's Wednesday at 9, you get sick now, you call your doc, oh, I'll see you Monday. You're going, great, well, what do I do the next 4 days? Suffer or get better? So if you come in and see me, happy to see you, and that way I have that relationship ability with your doctor to be able to say, hey, I saw Joe in the clinic, came in, got the crud, sent him home for 3 days, gave him, supportive care, supposed to follow up with either me or you on Monday, wanted to let you know, so that way he or she, if it's a female doc, they know what's going on so they can continue to take care of you. That's the idea of continuity of care. And so as a family practice, this is what I did in all my clinics, whether it was Fort Rucker, whether it was Germany, whether it was Belgium, whether it was in Iraq, whether it was in Honduras, wherever we are. Because again, are you going to see me all the time? No. So the same thing I expected with Scotty and with Lyra is we can be able to go, hey, saw so-and-so, this is what's going on, so we know. Because otherwise, I'm sitting there looking at a computer for 9 minutes, time reading everything, and you're over here, and you're going, hello, I'm over here. We want to have that face-to-face dialogue with you. So hopefully that's a way to tag back in, is to say. And that's the desire of the clinic. When Dr. Albert came and said, hey, can you start this up? I went, this sounds exactly like what I would do the last 25 years. And anybody who's been in the military knows, I've retired as an 06. What do 06s do? They do a lot of admin. As you move up in the military, you do more admin, less work. Probably the same way in here, too. The caveat, the caveat, you got the suits. The suits look down upon the clinic and say, please do hair. One of the things is, as I ran my clinics, whether I was the department chief, clinic commander, they're always like, well, if you don't do this, we're going to make you go see clinic. It's like, really? I'm a runner, too. What are you going to do? Make me go run? I like marathons. What are you going to do? Make me go what? Play baseball? Play sport? You can't punish me with making me do what I like to do. So I was able to effectively take care of patients, build a large population, much more than they ever knew, until it came time to deploy me one time. And then my patients revolted. But it's the enjoyable thing. I do most stuff. One of the things on the pharmacy, we're gonna have generics. Now, we're gonna have controlled substances? No. Why? Because then you guys will be in the office probably every day, not to see us as patients, to do reports. Again, think of your Alachua County Jail. Need to say more. So we won't have it. Some things we'll have to write scripts for, and how that part works, we don't. Somebody hit me up at the jail. Am I comfortable with ADHD? Probably, as you can imagine. Yeah, I can do that. But some things, a lot of stuff, as I do as a primary care doc, again, we got the basics, but I still sometimes need to tag you out to the specialist. Why? Because that's the right thing to do. You know, if you got heart issues, I'm not going to sit there and just see you and say, oh, no, you don't need to see your cardiologist. No. Got to find and work with your cardiologist. If you're a diabetic, I love doing diabetes, love doing type 1, type 2 care. My daughter's been a diabetic since 23 months. She just turned 23. We haven't killed her yet. She's gone through the teenage years. She's actually married to a canine handler out in Germany at K-Town, Kaiserslautern. Married him at Fort Rucker. He was the handler over there. Got Max's tooth. We had to put him down, or the Army had to put him down for cancer right before he PCS. So very comfortable with that. But do I replace an endocrinologist? No. But again, it's working with them, because if you try to get an endocrinology appointment every month, good luck. Up in our area, it's 6 to 12 month waiting. Well, what do? Stop having diabetes? No, that doesn't work. So again, it's being able to help that bridge and keep that going and get that through. And so hopefully we can provide you the care you guys deserve, you guys want, you guys need, you guys wish to have. And that's the goal we're trying to hit for. As I say, Lyra comes from a family nurse practitioner background. She's local. I'm coming down from Fort Rucker. Scotty lives down in Hernando. She's been a family nurse practitioner. A lot of work in women's health. A lot of women, a lot of areas. Gastroenterology as well. So there's a vast variety of experience to try to help hopefully meet your needs. If you click with me, great. If you click with them and you don't click with me, great. It's okay. It's a big world. Any questions? Any other questions? Ma'am?
Along with his question about the labs, does that also hold true with prescriptions that your primary care has written?
Yeah. And the kicker is, again, if I dispense it, I'm the responsible party. So I got to see and make sure it makes sense. And if it makes, and again, if it's a continuity med, it may be 2 minutes, just so I can just write a quick note. Yep, filling prescription for hypertension medication, doing well, no complaints. But the other part is, it's amazing because I got family. You know, doctor put me on this drug. Why? Didn't he explain to you? They live up in Missouri. So I'm like having to explain the risks, the benefits, figure out why they're doing this and explain to them, because they tend to not do that. I don't know if that's the same way down here, but it's kind of the thing. So yeah, I will see you to make sure you know what it's there, what the good parts are, what the side effects are. Make sure you're not having any, because sometimes it's amazing. Your doctors give you strips, you tell them they do something, they still write the same thing, and it's like, well, maybe let's try something else. Biggest example of anybody on blood pressure medicine that's on what's called an ACE inhibitor. About 10-15% of people get a cough with it. It's an annoying little cough. And it's annoying, and you tell them, just keep taking it, it'll go away. I got other ways to treat hypertension than to have you cough intermittently at the time. Why don't we try that? Works, doesn't work. Make sense? So, any other questions?
I just have, with the generic list you said, do you have a list somewhere we can actually see?
It's posted online.
Okay.
At least that's my story, and I'm sticking to it.
The other question,
I believe it went up yesterday.
I take Levemir.
Yes.
And does that have a generic? Or-
Levemir is not a generic yet that I know of. And again, if we have enough folks on Levemir, remember, it gets into price pointing. That's why the whole co-pays and stuff. So if we have enough folks on Levemir, and I love Levemir because it's once a day, sometimes twice, if the bridging's not working right, we can get it in so that way we can, again, supply it. Levemir needs to be refrigerated until you start opening it. And again, we got a little refrigerator for that, but nobody breaks into pharmacies to steal Levemir and insulins. It's amazing. Same way, you know, person's got 5 prescriptions. It's only the Percocet that fell out of the pocket, hit the ground, magically leaped up, and all the pills went down the skinny little drain. With the Xanax too. No. And so, again, if there's enough folks on it, that we can make it, again, affordable, because even though you pay a copay, somebody else is still paying the big pay, and that's usually the person in the nice gray suit to over me.
So if it ended up you did get it,
Yeah.
I wouldn't be paying a copay anymore?
Exactly. That's the beauty of it. Now, if somebody's only on one, like Harvoni is a great example, because you see the ads on TV. They're beautiful ads. 12 weeks, take a pill for hepatitis C therapy. Harvoni therapy runs about $98,000 for 12 weeks. Or the most hated man in America, the Martin Skykel, who took an HIV drug that was $750 and bumped up to $5,500. Why could he do it? Because there's no generic equivalent. Why he's still around, I'm not sure. But again, it's the economics is an ugly part of it, and we're trying to take that out. I'm conscious to it, having been government for 25 years, because the Army says, you get this much from your clinic, what do you do when you run out? They go, dude, you got this much. Start tap dancing and bridging. And so I don't like to do that. That makes not for good care. So good. Yeah, hopefully I answered your question.
How specifically are you filling those prescriptions? Do you have to have a handwritten one from your doctor? Or is bringing in the bottle that says you've got 5 refills left good enough?
Both are acceptable. Now, if your bottle is 2 years old, I'm going to go, remember that it says do not fill after this date. But if you bring in the bottle, or if you bring in a new script, as I say, happy to. Like I said, it's got to make sense. Yes, ma'am.
Oh, okay, so what about like the annual female GYN? Would you all be doing that?
We would be doing that. We have beautiful new tables. I don't think they got stirrup warmers on them yet, but we can get the little, I know, you just get the little heating pads, you put them underneath, nice little heating pad underneath, put some artwork on the top. But yes, and I did GYN. I did deliveries. There's a lot of family medicine I did. I can do colonoscopies, I can do flexics, I can do all those things. Are we going to have those things set up in our own clinic? No, because when you look at what it takes to do all that, all the background side, if you don't have enough volume and enough work, I mean, think about, somebody's got to clean that colonoscopy scope every time. Gotta reheat. But all those things come into play. Now, do we have an MRI? That was a question asked at the library, folks. We're not going to have an MRI because an MRI is 7 figures just to get. It's a 5-figure, $10,000 a month just to maintain. I mean, think of the volume you got to do just to support that cost and expense. But we have right below us, open MRI, that they've worked out a nice, good deal to where if we need an MRI, if your doc says, hey, you need an MRI of knee, shoulder, elbow, back, head, neck, spine, get it done down there. And I think it's no copay, which is astronomically, bizarrely beautiful. And so that's a good thing. But yes, get back to the next part. Mammograms and breast ultrasounds as needed. That's going to be referred out to one of the centers. Why? Because they do that every day. And you want that done and read by the radiologist and done right. And if you want to tap into that, because now I can feed into.
And your mammograms,
and
anyway,
you got to come over here.
Mammograms and those preventative things should actually be covered by insurance 100% anyway. So you should not be paying for those. And if you are, then we need to fix your insurance. But anyway.
This is Scotty.
I'm Scotty. My name's Elaine, but they call me Scotty because I'm from Scotland. I have been in the United States for about 16 years now, and for 15 of those I spent in Texas. I have a background in family practice. I also have worked in oncology, gastroenterology, women's health, women's primary care especially, diabetes, hypertension, osteoporosis, all that good stuff. So I have a wide background. I also have a little bit of background in gerontology with geriatric patients too. So it's a wide scope. And like I say, that I've also worked with the United States Navy in Scotland, so I know the model that we're using is it's like having a family. Everybody knows everybody, and you get to know your providers, you get to know your staff, you get to know it's first name basis and things, and so it makes it much more it's less like a clinical setting. It's more like okay, you have to have it done, and it's much more personable that way, and it works really well. So, and it's a good benefit for you guys to use it. So please feel free. Like I say, Lyra and I kind of work intermittently, different times.
Some of you
so.
even know her?
Yes. He's kidding. No, I'm from here locally, and I have a background from Shands in the pediatric ICU. So I do like stickers and lollipops. Some adults need stickers and lollipops. No, but I also have family practice for nurse practitioner. So I'm excited to be here and help you guys out and do whatever you need. So please come use us.
Any other questions? Oh, come on.
Just real quick, I wanted to hit on a couple things. The people that can use the clinic, Alachua County employees that are covered under our Alachua County health insurance. So if you work for Alachua County but do not carry our health insurance, unfortunately this time you cannot utilize our clinic. The premiums we pay into the health insurance is what's paying for the clinic. So that's kind of how that was decided at this point. The other thing, the hours of operation, they have Tuesdays and Thursdays, 6 a.m. to
No, 7. Monday,
7.
Monday, Wednesday, Friday at the moment is 8 in the
Just
morning till
till
7 at
7.
night. And then on a Tuesday, Thursday, we're doing 7 in the morning until 6 at night. We did it the early morning as well for fasting labs for the cholesterols and the thyroids and things like that. So
And
we'll be
nobody's
there.
nobody's really thrilled to fast Sunday night, Monday morning, and get their labs done. They need they usually need 24 hours of clean out and
They're usually having a
hydration.
party.
They promised us coffee and treats.
Yeah, we have those.
Coffee
We
and
have,
snacks, you can
we
have
have
that
those.
right after.
Yeah,
And
those
then
are afterwards.
Saturday, 9 to 3.
Saturday's 9 till 3, yeah.
Oh, and then the Millennium Center, where it's located. On the open house card, the address is on the bottom, but it's off of Newberry Road and 43rd, that intersection. The Millennium, it just says Millennium up top. Huge building, we're at the second floor. There's 2 entrances. One's off of, if you're heading westbound on Newberry Road, it kind of curves right into it. That goes to a back entrance. That back entrance is a little easier to park, and you can walk in the back entrance, go up the elevator, second floor. Really easy to find, easy to get to.
There's a PNC bank on the front side with a drive-through.
You can go through the front too.
Yeah.
Just more popular.
Your dependents aren't covered.
Oh, dependents, excellent question. If whoever is covered under your health insurance can be seen there, so if you're covering a spouse or children, you can have them seen at the center. I believe someone said 3 months up for like urgent care, but keep your pediatrician. They can't do annual shots and stuff like that. The good news is what they can do is sports physicals. So you print out the little form you need, and you can get your kids' sports physicals when you need them for free. I know I have a couple kids in sports, and sometimes it's hard to get hard to get them into the doctor's office to be seen in time because, we're good planners and we do it 2 days ahead of time.
Yeah, they bring it home the day before, going, I need this done,
Yeah.
and also I need to get to the sports store and get all the equipment. Any other questions? Nothing. Really?
You didn't introduce Anderson.
Okay.
When does it kick off and open?
We start up Monday. Again, we're small. You got 1, 2, 3. You got 4. Candace, come on over to the camera, Candace. Between the flags is what I heard. Candace is one of our med techs, and Kelly's the other med tech. Front desk is Brianna. She's obviously answering the phones and taking questions right now, and Caroline. That's it. And if we need to add more staff, we add more. We as we get busier, and we need more riders, more med techs, more front staff. If we need to add that, that's what generates it, is use and feedback.
And like
Sir.
you said, the office staff is there now, so you can go online or call in and make appointments. They don't open till Monday, but you can plan ahead.
Plan ahead. Sir.
I'm just trying to get a feel for the level of care, and the height of the care. So are we talking about sutures, broken bones? I have 2 little boys, it's nonstop.
Again, for broken bones, if they break a bone, we'll set it, or put it in a splint, get them to the ortho, which Ortho Institute's just down the road from us, unless you use somebody else. And then I found UF Ortho on 34th Street as well. Sutures, happy to suture, love suturing, suturing's fun. But sometimes, a lot of times I can go like term bonds and even a couple staples. Again, and boys are boys, and you know, you can scan the head and you can see how many scars I have. I've got lots of experience receiving them too.
It will also depend on the extent. I mean,
Yeah.
if it's like major trauma, there could be an issue. So they may need other, yeah, little things. Yeah, little things.
Finger bent like this.
Heads and fingers are usually the most common.
Wrists, forearms,
Yeah.
and so boys are boys.
Hoverboards.
Yes.
Those are all the, yeah, the hoverboards are now there, yeah.
Yeah. Any other questions?
Great, thank you. We appreciate you coming out.
Happy to meet you.